Affinia Healthcare, next on CityCorner. Hi, I'm Sarah Thomson and welcome to CityCorner. Today we're speaking with Affinia Healthcare, whose history extends back here in St. Louis for more than 100 years. Now, Affinia Healthcare, many of you know it, it serves as a dynamic and transformative healthcare system with 12 locations across the St. Louis area. So for today's first segment, we're actually going to talk about something you've probably read about and heard about a lot in the news, which is the rising STI rates in the St. Louis area. And so we're going to learn more about what Affinia Healthcare is helping to do on both the prevention and care side of that with their STI and HIV Prevention and Care program. It's my pleasure today to be joined by Dr. Juliana Castellanos, who is the HIV Prevention Project Director. Thank you so much for being here.
Thank you so much for having me here.
Well, when we have these healthcare segments, I love to start things off with just kind of the facts and what's happening and what's going on, because I think not just even in recent months, but even recent years, we continue to hear that St. Louis has a high rate of syphilis and other STIs. And so I want to kind of get into the details of that and then get more into your program, the work that you do and how you're helping address this. Affinia Healthcare is helping to address this in the St. Louis area. But first, let's start things off. I mean, I think it was just a couple weeks ago I read more about a recent report that the syphilis cases were still very high in St. Louis. Can you give us some information on that data that we're hearing about?
Yeah, absolutely. So definitely the cases of syphilis are increasing, and they are in this moment as high as in 1950, what is something crazy for me, because we have more technology, more treatment, better treatments, and better options for us to be preventing this. So in this moment, we have an epidemic of congenital syphilis. Congenital is the transmission from the mom to the baby. And it's important that women or people that can be pregnant have in their minds the importance of going to the doctor when they are pregnant, because it's easy for those that are taking care of themselves and they are going to the doctor, but there are many people that really don't have as a part of the routine to go to the doctor. So we need them getting tested for syphilis. Secondary to the increase in the cases, before they were testing just once for syphilis during the pregnancy. Now the doctors are testing 3 times, like every trimester of the pregnancy, because the babies that are being born with syphilis are having the consequences of the lack of treatment for people that can be pregnant. Mm-hmm. So yeah, we definitely have that, and it's important to mention also that these cases are increasing, not just in St. Louis, not just in St. Louis region. This is everywhere. This is in the country. But it's important for us to speak about how, for example, more women, the cases of syphilis are increasing more in women, and women are more potentially going to have a pregnancy. So again, to just try to do as much as we can to prevent
and you mentioned that it's increasing, syphilis in particular is increasing even nationally compared to other STIs. What do doctors, healthcare professionals think is the cause of that versus other STIs? Is it just that it's on the rise, or people aren't on the lookout for it? They're not as aware of how it's transmitted? Where does that kind of, I know there's so many factors that go into this, right? But what's sort of the explanation that we think is because of the rise, just because people aren't getting tested and they're not aware that they're transmitting it?
Yeah, I think there are many reasons that come to my mind that I can give you here, but like to be precise, we don't have a specific reason more than lack of education, lack of access to healthcare services. But yeah, no, I really don't. If there is a specific reason, I'm not aware of. And we have more prevention tools in this moment. So I believe that people are embracing more sexuality in a safer way. We have more prevention tools for HIV. Mm-hmm. But when we don't provide the precise information that this prevention tool, I'm thinking of PrEP, it's going to just decrease the likelihood of someone acquiring HIV. So people are going to be more flexible not using a condom. I'm not going to blame PrEP like at the main cause of the case of the increasing the cases. But definitely, it's just, I believe that it's more about education. So like if you are going to be taking PrEP, you still need to use a condom because PrEP is going to decrease the likelihood only of HIV. However, we have other prevention tools to prevent syphilis too, that it's doxypep. I don't know if you want me to go into that in this moment, but we definitely have prevention tools for syphilis as well. So I believe that in this moment, more of why it's happening, what it's happening, is what are we going to do to make a difference, because I don't know, like I believe I have a lot of reasons in my mind, but I don't want people taking what I'm saying like only answer, because there is not an only a specific answer. Like this is about people's behaviors, about funding in programs. This is about the lack of education. This is about different aspects. So I really don't want to go too deep into the why, more in like, what can we do to make a difference now?
Well, that's a great segue into talking about Affinia Healthcare and what you actually do on the STI and HIV prevention and care. I'm going to take it one step back, though, to like, this is going to be completely remedial for you, but I want to make sure that somebody listening to this, we kind of go through the basics, right? So if you are a human being, individual out there who is engaging in sexual activity, you can transmit an STI. There are viral STIs, and correct me, you're the doctor here, and there are those that are bacterial based, correct? And the treatment for those, can you just break that down really briefly?
Well, we have also parasites, and we have also, I think parasites is a third group there, but I always say that we have more than 30, like 30 different type of STIs, but there are 8 that are the ones that we track more often, that it's 4 that have a cure and 4 that don't have a cure. 4 that don't have a cure are HIV, hepatitis B, HPV, and herpes. And the 4 that have a cure are gonorrhea, chlamydia, trichomona, and syphilis. So that's the way that we divide it, because between those 2 groups, they are mixed between bacteria and viruses. But definitely it's important for us to know that between the 8 that are more important, there are 4 that have a cure and 4 that don't have a cure.
Okay, all right. And so if I am an individual and I want to then get tested, I can come into Affinia, into one of the locations that we talked about, and to talk about the prevention, not the prevention part, but the testing, what testing you offer and how that works.
Okay, we are doing a lot of things. So I will say that we have 2 different, I divide this into different groups, that it's clinical settings and the non-clinical settings. In the clinical settings, it's whenever that you go to see your doctor in Affinia Healthcare, you have the option to get an HIV screening. A screening is when you don't have risk factors. It's just we are offering this to everyone, because the CDC changed in the last probably 8 years the recommendation of who needs an HIV test. So it used to be people with risk factors. Now it's the recommendation. It's everyone between 13 and 65 years old should get or we recommend that they get an HIV test at least once in life. So that's what we do in Affinia in our clinical settings. We offer HIV, it's an opt-out HIV screening. So if you go, we are going to offer it, and you can say, thank you, we don't need it, or we don't want it, but we strongly recommend it. So that's in our clinical settings. In our non-clinical settings, that it's what's happening with the people that don't go to the doctor, right? So we need to make sure also to be able to bring those services to them. Ideally, and I feel lucky that the program has the funding that we have, because if it wasn't for that, we would be just able to bring education, but we are bringing education and testing to outside and doing outreach to the communities. So that's what we do in our clinicals and non-clinical settings. We are very strong in education. HIV and STIs have changed a lot. The way of diagnose, treatment, and prevention tools, this has changed a lot. And as I was saying before, even healthcare workers, we need to keep ourselves updated. So we need to keep reading, because if not, we are not going to be up with the most updated information. So just imagine the people that don't think about this in their daily, right? So we need to update them in everything that it's been happening, that it's the diagnose. Now we recommend everyone getting an HIV test independently of the risk, treatment. That also changed. Now everyone, as soon as they are diagnosed with HIV, they are going to start treatment and prevention tools. That is I would say that it's our second focus, it's prevention tools. So for prevention tools, We can speak about PrEP and PEP.
Yeah.
And DoxyPEP. Those are three relatively new because they are not so new. They have been around more than 14 years, PrEP. And the PrEP, it's a drug, it stands for pre-exposure prophylaxis, and it's a drug that it's a medicine that is going to decrease the likelihood of acquiring HIV when it's taken every day. Mm-hmm. So there are pills and there are injections. In Affinia Healthcare, we offer the pill. So it's a pill that if a person takes the pill every day, they are going to decrease the likelihood of acquiring HIV. Mm-hmm. PrEP and PEP and DoxyPEP, those are for people that have a negative diagnosis. So they are negative for HIV and negative for other STIs. PEP, it's pretty much similar than PrEP, but it stands for post-exposure prophylaxis. So pre-exposure, it's, for example, if I'm a person that is going to be in constant having constant potential exposition to the virus, that's good for me. Mm. Post-exposure is when, for example, people that are having sex without a condom or people that are sharing needles, that happens accidentally.
Yes.
So they have 72 hours to go and be prescribed PEP, and they will take it for 28 days, and it will decrease the likelihood of acquiring HIV. And I'm sorry.
No, and your last.
DoxyPEP, that is the last one. That's recently relatively new. It's also a pill. It's doxycycline, that it's an antibiotic that people can take it, and it's going to decrease the likelihood of acquiring syphilis, gonorrhea, and chlamydia.
Okay, no, and I appreciate you sharing that. I didn't mean to cut you off because for time, I want to make sure that we get this point across too, which is people hearing this, that you accept Affinia Healthcare, you want people to come in first and foremost to get tested and care, regardless if they're uninsured, underinsured. I think it's blanketed under this accessibility, right? So that's first and foremost too, for people hearing this, that they can come in and there's ways to make payments and get the treatment, but you want people to come in regardless of their insurance status. Is that right? Yes,
that's absolutely right. Even with the medications, we have assistance programs, and the manufacturing have assistance programs that I always say that our focus is that we are going to offer the resources that the patients need. It doesn't matter what we have to do, we are going to offer the resources. So insurance, non-insurance, gender, race, ethnicity, everyone is welcome in Affinia.
Yeah, and I appreciate that, and I didn't mean to cut that off, but I know that that's an important thing we want to make sure that people understand. You've been so informative. Thank you so much. This is a lot. No, it's a lot, and a lot, as you pointed out, has changed too in sort of addressing the rise in these rates, but also in the treatment, and I appreciate you breaking that down. That was really helpful. We're going to put 2 screens on the graphic so that you can learn more. We've covered only just a fraction of what Affinia Healthcare does in the community when it comes to healthcare, and so we've put the main contact information there for you on there, AffiniaHealthcare.org, providing high-quality care and exceptional service while promoting healthy lifestyles. That's the main information. And then as it relates to what we've been talking about in this segment for the HIV and STI prevention and care, there's the phone number that you can call. And that's also a drop down on the website to get more information and have access to some of the stuff that Dr. Castellanos was talking about today. But I encourage you to go to the website. But thank you for being here. I know that we could do this for an hour. There's so much more to share, but I'm glad that we got sort of the basics across and that you're doing great work to help decrease these rates and inform more of the public. So thank you.
Thank you so much. Can I say one more thing?
Sure.
With all the information that I provide, I'm inviting people to create sexual health goals. So now we have enough prevention tools and we have enough information and advances for people to think about what are my sexual health goals, because it's something that we don't speak often, and it's something, it's probably one type of goal that nobody thinks too often. But I hope that with the information that we had, people it's curious and go and do the research for them to be able to make that goal happen that they are.
That's a great way of putting it. I appreciate that. Sexual health goals. It's something we don't really talk about.
We don't speak about that.
Yeah, but a great way of putting that. Thank you.
Thank you so much
for sharing that. Thank you for sharing that. We're going to take a quick break, and we're going to have more with Affinia Healthcare when we return. So please stay with us right here on STL TV. We'll be back.
Visitors and residents love the St. Louis Zoo because it's free. There's a train, a carousel, opportunities to make new friends, and plenty of fun learning experiences with the animals 363 days a year. So come and experience St. Louis.
Eyes forward. Don't drive distracted.
Welcome back to City Corner. I'm Sarah Thomson. For today's program, we've been speaking with Affinia Healthcare, and we're now going to take a look at a taped interview that highlights more of their programs and services here in St. Louis. Hi, welcome back, and I'm now joined by Dr. Kendra Holmes. She is the president and CEO of Affinia Healthcare, and we're going to talk about strokes. May is Stroke Prevention and Stroke Awareness Month, and so we're going to talk more details with Dr. Holmes about that and what Affinia Healthcare is doing in that area. Thank you so much for joining me.
Thank you so much for the opportunity.
Well, let's get in here. We talked about May Stroke Awareness Month just to set the stage for that. And we hear stroke a lot, and people may say, oh, somebody in my family had stroke, but I don't know how many people actually know the details of what a stroke is. So maybe just walk us through the very basics first,
Sure.
and then we'll go from there.
Sure. So yeah, we hear a lot of people in our families that have strokes, but we really don't quite know what that means. But it's so prevalent. Actually, every 40 seconds, someone in the United States has a stroke. So what is a stroke? A stroke basically is the brain's equivalent of a heart attack. That's the way that I feel that it can be explained clearly. And it's basically when the blood supply to the brain is either greatly reduced or blocked. And it can be blocked by a clot. It can be blocked by various items, but basically an ischemic stroke, which the ones that occur mostly are those that occur due to a blockage in a blood vessel supplying the brain. And it's a medical emergency. And I just want to stress that a stroke is a medical emergency, and it should be really treated as a medical emergency.
So what are the sort of risk factors? What are the risk factors? What should people know? What should they look for?
Yes. So risk factors, stroke used to be a disease of older people. But now we're not seeing that. We're seeing that individuals less than 55 are, really having strokes. So what do you look for? Well, risk factors first. So the risk factors are hypertension. Hypertension is the number one preventable for strokes. If we can control our blood pressure, that's the number one. Also diabetes. A lot of people don't know that individuals who have diabetes are 4 times as likely to have a stroke. So controlling your blood sugar is key. Smoking. Smoking increases your risk of stroke significantly. So we stress to all of our patients and to the community to stop smoking. And just diet and exercise. A lot of it is related to obesity and the diets that we have, and that increasing your blood pressure, increasing your cholesterol. So really, if we can just control those health related issues, hypertension, diabetes, obesity, and not smoke, we can definitely decrease strokes.
And when we talk about the signs and symptoms, I mean, sometimes I've heard this before, people aren't initially aware that they're having a stroke. I mean, and then of course, once they get to the ER, get to the hospital, that's what's happened. But what are those symptoms? And I know it varies by individuals. Yeah. You could just
yeah, it definitely varies, but you make a great point. People just don't know. And what I tell people all the time is that your body. No one else knows your body more than you know your body. So if you don't feel right, you should really respond to those symptoms. And what we like to remember is called BFAST. So BEFAST. So B stands for balance. So we see initially you're off balance, you're dizzy, you may have difficulty walking. The E is for the eyes. So if you have a sudden loss of vision, and we see that a lot in stroke patients. F, which people are really familiar with, this is the facial drooping. So often if you see a person who's having a stroke, they can't smile because one side of their face will be drooping. The A is for arms. We see them, weakness in their arms or inability to raise one of their arms. S is for slurring of speech. So classic symptoms, they'll start slurring their speech or have difficulty speaking. And T is time to call 911. And I can't emphasize enough, with a stroke, this is a medical emergency. Do not drive yourself to the emergency department. Do not wait for a ride. with stroke, every minute is really your life. And there are millions of brain cells that die every second during a stroke. So you really need to seek medical help immediately.
No, I appreciate you emphasizing that because I know so many times we talk about the recovery from stroke. And again, it varies, but I mean, some people have long lifespans afterwards and others not so much. And I appreciate that clarity. I want to talk about women and stroke because women seem to be, I was looking at some of the statistics, stroke is the fifth leading cause of death for women
Mhm.
in the and it said in the United States, 1 in 5 women between the ages of 55 and 75 will have a stroke. And then once we get into African American women, it's a higher risk. So could you expand a bit more on that?
Sure. A lot of it is access to healthcare. It's access to healthcare. It's controlling hypertension. Unfortunately, diabetes is also prevalent with women and also in the African American community. So we just see a greater number of risk factors in that particular population. And then, I think the other part is sometimes women just kind of push through things, right? And that's why I emphasize again, your body, when something is wrong. And we also see a lot of strokes during pregnancy and directly after pregnancy in women where they may have preeclampsia, they have high blood pressure, or gestational diabetes. So that puts women at another risk for stroke. So, yes, definitely a disproportionate.
Interesting. I want to move into sort of, and this gets into Affinia services, like a recommended lifestyle program. So let's start on the preventative side first.
Yes.
What would you, and you've alluded to this, but clearly not smoking, but what would you, and when the doctors through Affinia Healthcare, what is a good sort of lifestyle program in stroke prevention?
Right. And you know what? Moderation. I stress this because I do a plant-based diet, but plant-based diet is not for everyone. But definitely increasing the fiber, fruits and vegetables in your diet is helpful. Sodium, a lot of people just don't know how much sodium is in food. So when hypertensive patients, we really stress for them to watch their sodium. Don't add additional salt to food, just to reduce that sodium intake. Exercise, one of the number one easy things that we can do to decrease stroke is just to be more active, just to move, to just maintain a healthy body weight as much as possible. And doesn't mean that you have to, go to the gym every day, but just walking, those things really do make a difference. Again, controlling your blood pressure, controlling your diabetes is really key.
Okay. And then what is there anything specific with Affinia Healthcare that you want to talk about as it relates to not just stroke prevention, but even the care afterwards? That's unique to what Affinia is doing.
Yeah, so we actually have a stroke prevention awareness event coming up next month, actually, for no, it's actually this month, it's May 22nd, at our Ferguson location. And so we're going to just really provide education, seek any individuals who are looking for appointments, schedule appointments for them. Because a lot of times what we see is that these are individuals who don't have a primary care home. So, it's a lot easier if you do have a physician that you can call and say, hey, I have these symptoms, and they can give you some type of direction. But when you don't have access to primary care, you're kind of out there alone. So this event is really to link individuals to primary care, get them into seeing our dietitians, and following up on just overall comprehensive care.
No, that's and so I mean, do you is it kind of I always talk about the older I've gotten, this whole thing of owning your own healthcare, right? Like there's this feeling that not to say that nobody else is going to do it for you, but you and you emphasize that too with what you were talking about in the lifestyle aspect, but you are your best advocate. You are the one who has to take care of that. And so I think what you're saying though is one primary key is making sure though that you still have a primary care physician who you're clearly seeing annually, but checking in with to help monitor both the nutritional side as well as just your day-to-day, your lifestyle, your behavior, your health. Yeah, is
Absolutely.
there anything to add to that, that you'd like to add to that comment?
Yeah, and I think when we go back to the women having the increased risk of stroke, we often are taking care of everyone else, right? And we have to make ourselves and our health a priority. And if it's just that one visit a year to the physician, it makes such a difference with cardiovascular disease, stroke, diabetes. So really just prioritizing health.
Mhm. And I do, and not to kind of go on the sort of, I don't want to turn this, it's been very positive, but on the negative side, for people to understand when you do have a stroke, what is that long-term survival prognosis? Because it's important to know because I feel like so much we throw around, oh, we mentioned family members. This person had a stroke, this person had a stroke, but we're not really taking into key that this can affect your life. You might have a short time thereafter, depending on the severity of it. So not to, again, like we've been pretty upbeat about this and focusing on the positive side, but I do want the public, when they hear this information, to understand we've kind of covered the signs, the symptoms, the preventative style, the lifestyle program, but then also what the outcome, what happens after you have a stroke.
So, it's really dependent on how soon you seek medical care. And that's why it's so important because, again, millions of brain cells are dying every second during a stroke. So it's really key, and it just depends on how soon you can get treatment. If you wait a longer time, it's very likely that you're going to have severe symptoms, severe issues. And stroke is the number one cause of long-term disability. And I don't think many people understand that. That is one of the key drivers for long-term disability. So it really depends on the severity. It depends on the blockage. It depends on if they're able to control your blood pressure in the hospital, because that will continue to cause issues. But it's really time is of the essence, and that's the determining factor. There's actual thrombectomy where you can actually surgically remove a clot, but there's a time limit. You need to be at the emergency department within 2 to 3 hours, or that window passes. And for individuals, when that window passes, that's when you see those long-term effects. People may not be able to speak, may not be able to walk, and death. We have to talk about that as well, because that is unfortunately an outcome as well.
Well, no, I appreciate you sharing that, just again, because it's kind of, I think, there's been so much public service about different aspects of healthcare and stroke. Again, May being Stroke Awareness Month, I still think there's a kind of a cloud around,
Absolutely.
this. And so I appreciate you kind of outlining it, breaking it down. Well, we've got the information. We're going to put that up on the screen right now. So it's Affinia Healthcare. For this particular area, we're looking at adult medicine and chronic disease management. That information's on your screen. The number to call is 314-814-8700. Or visit the website that's listed there on the screen. But Dr. Holmes, I know you're so busy. Just the other day, I saw something on TV with Affinia Healthcare, and I know I read about you a lot in the paper, and you're out in the community really making a difference. So I appreciate your time today to talk about Stroke Awareness Month and to talk about stroke. So thank you so much.
Thank you so much.
All right, we'll keep it right here, and we have more information on how you can reach out to Affinia Healthcare. Stay with us. Well, we've got the information there for you on the screen. If you want to learn more about Affinia Healthcare and its programs and services, the number is 314-814-8700 or visit AffiniaHealthcare.org. I want to thank Affinia Healthcare for joining me in studio, and I want to thank you at home for watching STL TV. And keep it right here on STL TV, Experience St. Louis.